It was just waiting to happen, and we just happened to be there at the right time. When we arrived, we were in the middle of the worst of the AIDS epidemic, and patients and staff were dying with no palliative care, and it was just a privilege to be able to introduce them to the principles of palliative care and the practice of it.
What does Muheza mean to you?
Home. It's home. As well as having a home in England, it will always be in our heart. I feel I belong there. I feel a little bit of me is there and stays there. It's where my heart is.
We decided that we would, in general practice, go and do a diploma in tropical medicine because I was very keen on tropical medicine. So we did this for 3 months, and we looked around for somewhere to try it out in Africa or even South America. But we bumped into John Wood in the corridor, and he said, well, why don't you go to Muheza? So we thought, well, we'll have a go, and we sent a letter to Dr. Elizabeth Hills asking if we could have a look at primary health care in Tanzania.
And her response was absolutely classic, wasn't it? I'm desperate for doctors, I don't know about primary health care, you can come and help me out, and if you're lucky you might be able to have a vehicle to go to the health centres. The many visitors who've come to this country and learnt things from Hereford Hospital have all taken something back to Muheza. Mary, the palliative care nurse, when she came out to England over to St Michael's Hospice, she was one of the first hospice visitors, and when she went back to Muheza she said, palliative care is not just for patients, it's for the whole family, and that was a complete revelation and a change of attitude to starting palliative care over in Tanzania.
Visitors from England, they find it really a life-changing experience. They didn't realise that's Africa, which is so different to us.
Many of them have gone back a second time or a third time.
Some people have made big contributions, such as Arthur, who's the plumber, who's still working actually in the health service, but he must have been nearly 20 times, and he perhaps produced more benefits in the plumbing line than we did in the medical line. I don't know.
John and I played a very small part in the clinical side of the Muheza Link. We knew we wanted to form a link in East Africa because we knew that best. The village was was busy, lovely marketplace, people waving at you, you've never seen them before, very friendly, very nice. When you get to the hospital, of course, it's several different wards down a long corridor, and it was quite a shock to see more than one person in the bed and possibly one underneath the bed. We knew from past experience that it was best to start at the top, so we went to the Archbishop and the Ministry of Health, and then every time when you went down to the bishop, they said, oh, it was a very good idea, but I'd better ask my boss. We said, well, actually, we've spoken to your boss, and he's really enthusiastic, and ditto on the admin side. And so, in fact, in the 7 days that we were out there, we finished all the communications in about 6 days, and the 7th day we sat on the beach. People would come to theatre on a contraption which had a chair with bicycle wheels, and things like that. It's quite clever. There's a lot of ingenuity has gone into managing with very little resources. John was very, very keen to try and make it as equal. We weren't going out to be benevolent, we were going out to learn and to exchange ideas. I think it's the longest medical link in the country, but I may be wrong. We are proud of that, and I'm sure everybody who's worked there would be proud of it too.
My husband took up medicine late and was passionately keen on it. He was also a great traveller and interested in going to different parts of the world. He went out in 1986 as one of the first doctors and did a 6-week stint there as obstetrician gynecologist. He didn't get an opportunity to go back until he retired sometime later, I think in 2002. He then went out and spent just over 3 months. I just joined him for a month and had a very interesting experience. As a teacher, I was given an opportunity to teach the nurses. The students came in looking immaculate. They were very well behaved, very polite, and at the end of the class somebody stood up and gave you a vote of thanks. I think the Link Society has been invaluable both for the Tanzanians that have come over and experienced a bit of life in this country and seen how our hospitals work and services are provided, and equally important for those going out to Tanzania. It's opened their eyes to a totally different way of life. They've seen a very different type of medicine, and mostly they've come back very impressed by what they've seen, and they've also come back and valued what this country has in contrast.
I got a chance to visit Hereford in 2013. I learned a lot of things in the dermatology clinic. Thank you a lot, and may God bless you all. Thank you.
By the time I went to Hereford, there were no any other assistant medical officer radiologist. But now I'm doing things related to radiology. Without that link, I think for this time, nobody will be here to help us. I'm doing now.
Hereford Link has helped me a lot to build up capacity of me professionally, and also I managed to visit Hereford. From that I learned a lot as I did my rotation with the cardiovascular. So there's a lot of things I learned from there.
I think this link, Muheza Link, is important in 2 areas, for the hospital and for the staff. For the hospital getting the money from the donor, purchase some medical equipment which is beneficial for patients. On the side of the staff, it helps to get the money for higher education for those who are going to school. Some of the staff, they attend to the conference according to their professional, so that it helps in one way or another. So we would like the visitors to continue to visit us because they help us.
The link has a big help to hospital. For example, I receive digital tonometer and the Goldman tonometer.
Hereford Link has been very beneficial, especially to us. We have been benefited from educational funds. Many of us at the hospital and hospice went to school.
I went to Hereford in 2023, and this is after several years without visit due to COVID pandemic. I learned a lot of issues in surgical department as a clinical observer, and I enjoyed my presence there. I think this link should be continued because I have learned a lot, and also we need to receive more visitors in our hospital and also medical students. Thank you so much.
We depend on you guys, and my request, don't get tired, because many people are benefited with our service here because of you. Thanks.
I was a social worker at St Michael's Hospice, working with children and young people. It was from that that we thought about making this connection with the hospice in Muheza, I'd really seen the significance of when young people come together, when they're experiencing grief, and when they're in a room together, and when they don't even have to talk to each other, but they're able to just come together and really experience being with someone. I had this thought that, well, what happens if we take the children across the other side of the world to a completely different continent? Will they get this same kind of connection? Will there be a connection from the children and young people over there? And so I was really excited that we might be able to give them another part of their journey, another acknowledgement, another significance, another coming together, just in a completely different way that we hadn't done before. And there was this moment when the kind of older ones were all sat together and they were just sharing, they were just in small groups, and they were just sharing their stories with one another. They were talking about the people that they had lost, that had died in their lives. And there was just this beautiful moment in the room when everyone it was just really connected. And I looked around and I thought, this is really what I'd seen here, and it was happening there, and it was beautiful. The opportunity that Link Society provided us is really indescribable. I don't think it's something, I wouldn't have come across that in any other form and opportunity in my life. And I think if you hear the young people talk about their experience and to be out there and witnessing it, I think it gave them something really incredible as part of their journey.